Hello, everyone. Good evening and a warm welcome to this roundtable discussion on a relevant topic, nurturing a health-first mindset in the workforce. I'm Pooja Bothra, Senior Content Lead, ETHR World, and your host for this session. In the journey of designing an innovative and productive workplace, a health-first approach flowing from the top to bottom can make a great impact to the lives of both employers and employees. Prioritizing employee health means emphasizing health and insurance policies, enhancing employee benefits, rethinking work practices, reinforcing health assistance efforts, and so much more, all of which translate into a healthier and more engaged workforce that is visibly satisfied with its employer. After all, employees deservingly want their well-being to be an employer's topmost priority. In turn, employers benefit from higher employee proactiveness and productivity, lower absenteeism and attrition. To further deep dive into the subject of nurturing a healthy workplace, we have eminent personalities from the industry. And without much ado, I would like to introduce them to you. Please join me in welcoming Satya Narayanan Vishwanathan, Senior VP and Head HR Global and Head of Corporate Quality, CSS Corp. Shrirupa Sengupta, Global Head HR, 3i Infotech. Swati Pasumarthy, Total Rewards Leader, Global Business Services, PepsiCo. Tushar Sharma, Head of Rewards, Philips. Biresh Giri, Executive Vice President, Actuary, ACCO. A very, very warm welcome to all of you leaders, and I'm so thrilled to have you here to talk about nurturing a health-first mindset in the workplace and to the workforce. Dear viewers, I'd like to welcome you also to this show. We want to make this session very engaging and interactive for you. So please use the Q&A tab on your screen and share your comments, thoughts, as well as questions. Do not wait till the end of the session to put your questions. We'll start taking your questions right from the middle of the session. The environment the leaders creates for workforce goes a long way in developing their values, habits, priorities, and behaviors. I would like to request Satya and then Tushar to share the essential building blocks of a health-first organizational culture. Over to you, Satya.
Thanks a lot, Pooja. A very good afternoon to the enterprising audience. I'm expecting a flow of questions, healthy questions on health. Since this topic is about building the essential blocks, health first kind of a thing, maybe I should start with a simple quote of my own. The first basic building block is we have to get rid of our mental blocks about health. I was just thinking about this topic, health first. Why are we even talking about it? I go to a stock market for investing. I look at the health of the stocks. I go to the airlines industry. We look at the health of the machinery that is there, whether it is the airports or whether it is the aircrafts or whatever. We go to a agriculture industry, farming, whatever it is. We look at the health of the field, the health of the crops. Everywhere we go, we look at the health of things before we start doing or we improve the health. But when it comes to a people-centric industry, whether it is IT or whether any other form of an industry, somewhere there is a misconception, I should say, that health of an employee is their own subject. Whereas in all other cases, we think that health of what we deal with, be it an aircraft, be it a stock, be it anything, is something to be researched. When we come to our workplace, We do a lot of things, as you pointed out, Pooja. We do a lot of things. We do have this policy, we have that policy, we top one with the other. But somewhere, if we start disassociating ourselves with the health of our employees, it is not the right thing. So obviously, a health first policy is a very basic, the given thing for me. And when we look at the health of an employee, is it about only certain things or something beyond? A quick check would say that somebody has a health problem due to age. I mean, all of us would be having a workforce ranging from say 20 plus up to 60 or a little beyond 60. People come from various demographics. So there are bound to be various health issues at different points of time. There could always be a physical health problem. It could be congenital. It could be something else. Or in the kind of circumstances that we all have been braving for the last couple of years, it could be a pandemic. For no fault of theirs, people could be contracting a dreaded virus. People may be fighting with it. Unfortunately, we all have seen certain amount of human losses, lives being lost. So it comes and impinges on us from various formats and various facets. So I would like to classify this into multiple segments. There is a congenital thing with an employee at whatever age group. Maybe they have a cholesterol centric family, they are heart disease prone. Maybe they have their own personal habits, whatever reasons, personal pressures, financial pressures, they run into certain habits, substance abuse, etc. They start ruining their health. The third element is an accident or a pandemic or whatever, which is a kind of an uncontrollable beyond what you do. And fourth is the kind of workplace that we run for an employee, whether it is toxic or whether it is positive. So all these things go together. So in my humble opinion, there are certain things that we need to bring in as a culture of the organization. When we talk about health first, we all need to be aware that health of our employees is of supreme importance, not just discussed as a topic during a pandemic or certain other times. It has to be there. So in our organization, we have reimagined our core values, considering that we are celebrating our Silver Jubilee anniversary last year. And our core values are essentially five. It's about daring to excel. And the second, I always consider it as the most important, respect individuals. Whenever an individual is respected, be it a family where a lady is respected, be it a society, wherever you respect people, automatically there is a positivity that comes along. And the third element of our core values is emulating integrity. So in my opinion, respecting individuals and emulating integrity creates a very, very clean, clear, less toxic workplace, which is an essential ingredient. Imagine people are going to spend 9, 10, 11, 12 hours, you know what. And if that place creates stresses and strains for them, they are more prone, more likely to run into life. I mean, we may classify it as a lifestyle disease, but its ingredients, its seeds are possibly sown in a workplace. So we are extremely careful about our workplace. We respect every individual. And recently I'm going through reading a hot seller book. I don't want to name it. A multi-billion-dollar company was running practices which was extremely difficult and stressful for employees to adhere to their values, ethics, and integrity. Right? So we do have all the other things that go along with that. Whenever there's an whatever you call as an ash case or a posh case, we have a complete no-nonsense policy about it. We do not allow any form of you call workplace bullying in any other way. These are things that are directly under my control. So these very positively influence the employee's health. And last but not the least, there is a personal connect. In my role as the head of HR, which I consider as a family patriarch role and not a corporate honcho, I have introduced a form of celebration of people who have contributed long time in the organization, say 15 years. I spend half an hour on the day with them, spending my time with them, understanding how they have grown up, applauding their success. And one message that I've got from almost all of them is, this company is like my family. Whenever I was in trouble, CSS has helped me to come out of it. That has created that stickiness for me in continuing with CSS all these days. And during the pandemic times, me and my entire HR workforce globally were connecting with people who were affected. When they were affected or when their families were affected. I think few hundred calls from my side has gone to employees personally, just reassuring them,
Yeah, and
filtering out on that chat.
and it's a great example and a great validation of the fact that high touch is here to stay. So, the example that you've shared about, congratulating them, applauding them, and, talking to them, it really shows that how much ever we, use HR tech, but high touch still is here to stay. Tushar, some quick points from you on the building blocks.
Thanks, Pooja, and thanks for having me. And I'm glad that I can, understand and learn from all the fellow panelists and also from the audience here. So for Philips, our purpose is very strong. We want to improve the lives of 2.5 billion people per year by 2030, right? So in a way, what has worked for Philips is how do we integrate the purpose of the organization with the well-being of employees, right? That's number one. And in terms of some of the building blocks of our well-being strategy, I would like to bucketize it into broadly four areas. One is physical health, right? And this talks about ergonomics. This talks about your insurance policies, your accident policies, and all. Then I'd want to talk about conducive environment and a psychologically safe environment for the employee to operate in. That's second. The third one is around social well-being and a culture of diversity. How do we, promote a social connection within the organization? I think Satya spoke about being like a close-knit family. That's one, but also about how do we engage and encourage diverse views. And lastly, it is about emotional well-being, which is about how do we manage the daily stresses of work life. Now, all of this has to be underpinned by leadership pledge and commitment. So we have a written leadership pledge and commitment. It has to be underpinned by manager capability. And finally, it has to be underpinned by change management and employee communication. So these are my opening remarks, in a way a bit short, but I can speak more if required later. Pooja, over to you.
Thank you, Tushar. Clearly, your and Satya's points do tell us that, leadership has authentic care for employees in their hearts and minds. And there is a huge intention is there. So I would like to invite Biresh, who's an actuary expert, and ask him, what kind of insurance tools can help organizations create a health first attitude and implement it.
Pooja, in our experience of offering the group health insurance to the market in the past couple of years, what we have seen is that the organizations, of course, talk about promoting the health first behavior and also taking care of the employees' health. But when it comes to offering health insurance, it is a very basic insurance which is provided to the employees. Okay, and that is only limited to taking care of when the employees or their families are going to hospitals. Okay, and we all know that taking care of the health is much more beyond that, and maybe the first step of that is to try and ensure that that situation itself does not occur, in the way of maybe promoting preventive healthcare more than just offering that covering the expenses at the time of hospitalization. Okay, so we as a company, we kind of saw that as a gap in the market, and we came up with a product where we are covering end-to-end solution for the employees and the employers, where we don't only cover the inpatient hospitalizations, but right from a doctor available on a call to offering to ordering medicines or ordering health checkups, etc., which helps us employees in being in touch with any healthcare service providers which are there at any time. Okay, and over time we'll also be coming up with facilities where we'll be offering disease management. For example, a lot of employees may have parents who are suffering from some chronic ailments, and it is not that they will be needing some hospitalization related needs only. They may need help in terms of managing their chronic ailments, etc., which will be very beneficial. And we have done some surveys asking the employees whether this will be something that they need, and they really like it, that if somebody is able to take care of their daily pharmacy needs, or somebody is available to talk to them whenever there is a need, somebody tells them that what is the way to manage their lifestyle, to be able to manage their health condition that they are suffering from, that is going to be really very beneficial for them. Okay. Even for the employees also, if we are able to create some kind of a mechanism which incentivizes healthy behavior, okay, that also goes a long way in keeping the workforce healthy. And there are sessions which can help them with that. There could be challenges that can be promoted among employees. There could be some groups that can be created where employees are getting into healthy activities, challenging each other, pushing each other to do more about it. And it not only just creates a healthy behavior, it also creates a much greater bond among the employees. And all of these can be with the current use of technology, can be done in a very efficient manner. And I'm comparing that with a very, very offhand just group health insurance for employees, where they just in many cases the employees don't even know the name of the insurer. They only maybe know the name of the TPA, who are the much more continuous service provider for them, but the insurer does not even come in the picture. Okay. And this is something that could be looked at in terms of changing going forward. And also in terms of approach, I think the HR teams may be something, maybe may try to push for something which is beneficial for the employees. But when it comes to decision making, there's a lot of focus on just cutting the cost. Okay. And lot of times we have seen most of the companies, they just compromise on this aspect, where cost becomes a major factor, and everything else goes to the back seat in terms of what else could be done for the employees. And it is not that if these things are done, all the costs will come to the employer. A lot of these things could be designed in such a way that employees will be happy to contribute also. And the employers could be very upcoming in terms of what is their budget, and there could be solutions which can be created where within that budget only whatever is possible can be done. And we can also create some kind of a contributory program where employees are happy to contribute in that as well.
Thanks, Videsh. Quite thought-provoking, and you've left us with enough food for thought. I'd also like to tell the panelists that this session is very conversational. Please feel free to come in with a follow-up point after any of the speaker has shared their inputs. I'd like to go to Swati now. Swati, as a new GIC growing rapidly in the industry, since you're a part of this new GIC, many of your employees have never met each other, yet you have the challenge to make them believe that your organization puts their well-being ahead of everything. You have led PepsiCo's GBS from a reward standpoint ever since its inception 2 years back. What has been your learnings?
Thanks, Pooja. Thanks for getting me in on this question. And this is something that's extremely close to my heart as I speak about it. So before I come to the learnings part, let me elaborate a little on the context which Pooja shared. So I know all of you love us for the food and beverages that we put on supermarket stores, but as a GIC, as an in-house capability center, we started our operations in the year 2019, which is about 24 months ago. And in these 24 months, we've grown from a headcount of 0 to 2,100 and counting as we are today. So we had all kinds of awkward situations, if I can call them, wherein we had a Monday where more number of employees were joining us than the headcount we had at that point of time. We had more number of people conducting induction sessions than we had the employees in the session. So all of that happened. And about 8 months into our operations, we had to move to work into a completely remote context, which means that about 70% of our employees or more that we have onboarded today have all joined us virtually, haven't been to a PepsiCo office and haven't met a colleague or haven't even met their managers. So in this context, it is extremely important for us to convey the message that they are the center of everything that we do, not the transitions, not the growth plan, or not even the business, but the employee is the first priority for PepsiCo today in HPS. And how is it that we drive this message to the employees? So if I reflect back these 2 years, I would look at it in two parts. Of course, there is a science element to it where, today the industry is converging. We all are so connected. We all know from each other what is it that the others are doing, and we all strive to give our employees the best. So we all, if I can say, converge towards the best practices, learn from each other and deliver it to our employees. But having said that, what is that differentiator? What is that art element of the entire benefits wellness programs design that makes you as an organization extremely unique, different, and it makes you special to your employees? And on that note, I think for us in PepsiCo, when we started, we were happily about 50 employees sitting in a bay, and every employee felt empowered that they had the voice to make a comment or propose a change to what we at that point of time had a benefits offering. So today what we have as the benefits and wellness offering in PepsiCo is not actually something that we designed, we branded, and we communicated to employees, but it is in a way the sweat of the employees too, because they were a part of every iteration. Either they came in and supported us with a comment, with a suggestion, or sometimes they were even, volunteers to work on a change proposal for our benefits agenda. So when we integrate the voices of employees, and it need not be all the 2,000 employees, even if they know that, 10 of the employees have been a part of the benefit program design, or their voices have been heard very seriously, I think it makes a very significant difference to how employees start identifying with the organization. So to answer your question, or kind of to summarize, Pooja, I think that authenticity and involvement of the employee's opinion and voice, and putting them truly at the center of everything that we design, I think is extremely important. We may in the process need to be agile. We may not have the luxury to wait 1 year before we revise a policy. It may mean that policies need to be sometimes revised and rolled out in 24 hours. But nevertheless, I think that means a lot to employees, and that makes them a part of the entire wellness agenda that we're propagating.
Thanks, Swati, for that. And, if anything, the pandemic has taught us is to be agile. Most organizations implemented work from home overnight. So I think we all have become masters of agility. And the fact that you said that give employees what they want, hear them and integrate their desires and aspirations. That brings us to another thought, that is that an organization is made up of diverse workforce. How do you incorporate an organization-wide health first strategy? Because everyone's needs, aspiration, demands, circumstances are different. Shirupa, please share your thoughts on this.
Thanks, Pooja. Thanks for having me here, giving me the opportunity to hear to so many of the esteemed, fraternity colleagues. So I think I'll like to start with saying that this pandemic made us very vulnerable. We had taken life for granted. That got challenged. And, it took us back to the basics. We went back to the hierarchy of needs defined by Maslow. So our physiological needs, our safety needs, and our need for love and belonging came to the fore. Thus, as employer, we needed to create this safety net of physical as well as mental health. As an organization, we needed to find that, what are those needs which are cutting across all the employees, and what are group specific and tailor-made our plans accordingly. As you rightly said, our employees have a diverse ethnic background. They operate out of different countries. 21% of our population is women. And what initially began as a knee-jerk reaction and a survival instinct, survival in terms of business survival, later was part of the overall people strategy underpinning most of the people decision. So, as the other esteemed speakers spoke about, what came out was a need for a very robust health insurance policy and also a term life policy for everyone. What also cuts across is the ability to work from home. And I think within 7 days, we had reached out laptops and desktops to the home of every person. Until date, we have not gone back to work. So, while these were survivals, the second point was definitely a survival instinct. But I think this has now become a way of life. It has become a part of our global strategy where we are also attracting talent by saying that, these are the things which are available. So, what is also common and is the need to be listened to, someone to talk to, in some cases, counseling also. So creating those teams who can provide counseling, creating a network of HR business partners and training them on this job became important. Now, what we saw that while we talked about certain things which was cutting across the entire organization, there were certain needs which were specific to countries. So the way the healthcare system is available to different countries is not the same. So the need for resources was much higher for the Indian population. So maybe doctors, maybe, oxygen, maybe accessibility to hospitals, everything was more needed in this country. Whereas, when I talk about another group, so people who were working away from their families and they were sort of in foreign shores, in the first phase of lockdown, what happened is they were actually locked up in different hotels alone. And you can imagine what kind of mental stress they were going through. So, we created this task force whose job was to talk to these employees not once a day. So there were 5-6 members who used to call them up 5-6 times a day for days on end, just to give them that feeling of, belonging to the company, catering to their psychological needs, and all of that. And then of course, as policies, vaccination or doctors and other resources on demand, some contribution for people in need, these were all put across. And just to summarize, I would say that finding out what is common across all the groups and what is specific, and to cater to both of this, I think was what made us survive and be appreciated by our employees.
Interesting, Shirupa. Birish, I would like to ask you, how have you been able to solve this for your clients?
Basically, in like many times, the employers themselves have plans which are kind of catering to the needs of different employees, of different grades of employees. We kind of help them in designing that in case somebody needs our help, and we try and come up with a solution which is taking care of everybody in the organization in the diverse employees segments, like for example, be it somebody from the LGBTQ community, or if somebody needs help on coverage on the IVF, etc., which is not something that was there before. For example, earlier, necessity of somebody being a legal spouse was a mandatory thing, and that is something that is over time getting relaxed to a large extent as the society is changing. In terms of creating different type of coverages for senior versus junior employees, we also have something like a flexi benefit where the employer can have just a budget for different type of employees, and the employees could potentially choose a particular cover that they want within the budget that is there, right? And we appreciate the fact that the way employers try to offer a one size fits all kind of a coverage, which is mandated for everybody, may not be suitable in many cases. Okay, so if we try and offer that, that may help many of employees in selecting benefits which are much more kind of complementary to them in case they're already covered from their own some kind of the same budget. So the employer's total cost does not change, but the total solution is much more beneficial for the employees depending on what other solutions they already have. And all of this can again be offered in a very easy manner. It is not something that will increase the cost or the hassle of the HR. All of this can be handled in a very seamless manner with the use of technology. We also have designed a very innovative kind of covers which can be topped up on top of something that the employers are offering. For example, if somebody wants to increase their coverage from whatever the employer is offering to them, or if somebody wants to enroll their parents, for example, on if they're not covered by the employers within the program. Many of the insurances do not cover, say, some items which are generally deducted at the time of final claim payout. So, for example, if you guys have experienced, if you claim say 1 lakh rupee from an insurance company, they pay you mostly 70 to 80,000. The remaining is deducted because there are items in the bill which are not payable. In case somebody wants that also to be covered because they don't want to pay anything from their own pocket, all of that can be covered, for example. So there are many covers that we have come up with like these, which are kind of first in the market, and helps in different types of meeting the needs of different types of employees within the organization, and creates a solution which is kind of all encompassing.
So, so flexible benefits is the answer. Huh? So I think Biresh spoke about it, but I can tell you we are now in the 4th year running of flexible benefits for Philips. And the way we started, we had created personas. Then we gave a lot of options. So today we have 13 medical plans, 5 OPD plans. Term life can be topped up. We have critical illness covers without really increasing the cost of the company. And for the employee, it's choice, because one size definitely doesn't fit all. The second one is that in terms of funding, it is not as if there is a general fear that the cost will go up. But you'll not believe that for us, almost 94 to 95% of the employees actively now understand the benefits. So that's a big ROI for us. Then, of course, we have one is understanding, the other is utilization. But we don't only flex insurances, we also flex the non-insured benefits as well. So it has to be a bouquet approach. But yeah, I think can speak a little bit more later. But I think flexible benefits is how a lot of companies are looking at the space of health and well-being.
And Pooja, if I may add, so it is also sometimes a fine balance between what employees want and what is right for them. Because, especially in our industry, we see that a large segment of the workforce is young, and sometimes they don't understand the importance of an insurance program. So while, it is as important for us to give them the choice to take what is right for them and to at least cap it at some basic value, but it is equally important for us as employers to invest a lot in educating them. And when we educate them, to build these awareness, I've seen that having a slightly differentiated approach where we run these sessions specifically for a given segment of employees attracts them and attracts their attention really well. So I think, as much as we invest our thought in improving the overall flexibility of the programs, we also need to put an equal and more effort in educating and bringing in that awareness in employees so that they also make the right choices for themselves.
Very valid point, Swati. I totally agree. And, then only they actually understand what they're getting and how it is an integral part of their benefits. Otherwise sometimes, these things do get missed also. And there is an audience question from Shireen. Shireen, she's a head HR at Trans Technologies, and I know her well. She is asking, what are some unique benefits that you introduced in the last 1 to 2 years to demonstrate to your workforce the organization's health first mindset? I want to take this question. Anybody can feel free to jump in to share your response.
Actually, there have been many, and but the most impactful that I can think of is our long-term hybrid work strategy, wherein we call it as work that works in PepsiCo, which means that employees will come to office only for the work that needs to be done out of office, and for work which they can do as an individual, they can continue to do it out of home. So we've taken a very long-term view on this, and we've openly shared with all our employees as to what are the areas that we think they need to come to office for, and they can have discussions with their teams, with their managers, to see and identify what is the split that they will need to do. So this is a long-term approach that we've taken. While in the short term, we have told our employees that they will be returning, or we will be asking them to relocate back to Hyderabad only in the April of next year. So we've given them a good runway so that they can plan their location, their priorities, their health, their wellness well. But having said that, I think the most impactful benefit to employees today is that we have launched what we call as the Work That Works program.
Possibly, I can also share a couple of examples. So I think we have increased our coverages, health insurance coverages across board, right? So we are even doing it this year as well. And we introduced significant higher amounts of sum insured in our OPD plan. So that's one. The second one was that we introduced, teleconsultation services and dietitian consultation services to all our employees. And that along with hospital support, emergency support, because a lot of times during the last 1 or 2 years we found that employees were struggling to find even hospital beds. So we introduced that. That was a big one. That was a need of the hour, and we kind of followed through. The third big one, which I think has always been there, but I think it's a very unique benefit that we have at Philips, is we have unlimited sick leaves. So we don't really put a cap on sick leave. So if you are sick, you take leave. Simple as that. We are a high technology company, and we kind of believe in the fact that employees will utilize it consciously and judiciously. And that's the third one, which I think employees really value and appreciate, and that develops an emotional connect with us.
Pooja, from my side, if I could just chip in for a minute, I just completely second what Shwati was mentioning about the extended work from home. Our 11,000 employees, excluding the ones at China, are working from home almost all through this year, and we ensure that peace of mind around when they should come back is on a constant flow to the employees. Second, I agree with Tushar, the methodologies about what they have been doing. And a couple of quick things from our side. We built this hospital and doctor in multi-level. We have a very, very simple dial a doctor 24/7. Pick up your phone, talk to somebody. It's the easiest thing to use. Second, we are also tied up with large-scale networks, apps, and other things where people could rope into emergency services, doctor on consultation, etc. Third, we gave a personal touch by having a rapid reaction force right within the organization. I remember distinctly certain Sundays late in the evening, we were in search of an oxygen bed for somebody whose in-laws were suffering in a hospital, and the oxygen was about to be turned off in a few hours. It was like a cricket match, unfortunately, but we were ensuring that the concerned gentleman was able to be shipped to another hospital 90 kilometers away on an oxygenated ambulance. So these are certain things that I could recall. Perhaps a lot of us were doing similar things, but it's kind of reinforcing the theory towards the health first.
Interesting, Satya. I'll just take one more audience question here. And Sulekha, who is a founder at Gyan Paradise, is asking, are there any specific design policy for women employees? Birish, would you like to come and share some response here?
I can't think of anything that is only designed for women employees, but generally the cover itself is designed in such a way that it takes care of everybody's needs, and no employee or their family members, be it any background or suffering from any condition, are left out. Okay, and the coverages, there are women specific coverages which are anyways part of the cover that is provided. While on this topic, I can tell that we have designed policies not for women, but a separate type of workforce, which is the gig economy workforce, where the needs are very different, where they log in, log out anytime. They could, on any given day, they might just do 5 rides. They might come today, may not come tomorrow, and stuff like that, which is very different than a normal workforce who are working throughout the year, right? So, yeah, and if you want to provide the coverage, mostly, for example, for accidents while they are logging in, or maybe the day they logged in, for example, or something based on that, it could become a bit complex. So we created a solution which we are offering to a large section of the gig economy, where we are providing these benefits at a very affordable cost to the employers in that segment.
Maybe I can chime in, Pooja. So at Philips, we have some specific women-centric modules as part of a flexible benefits offering. So we have created a module which is around women care, and there we cover cervical cancer vaccination cost. We also cover in that module ability for an employee to enhance the maternity cover. So in a way, let's say if the standard health policy has an X amount of cover, you can actually take that module and enhance that cover. Then we have modules which talks about infertility and in vitro, fertilization or IVF covers which are there. So I think these are the three that I can think of. And of course, the other ones are around maternity benefit and leave, which I think is fairly commonplace across the industry. But I would say these three are the big ones.
So today, technologies such as AI, cloud, data is empowering the employer and also helps to, personalize experiences. Digitalization is also helping us to expand our reach, because mobile phones are accessible to all. Even there are shop floor employees who do not have, laptops, but they do have a mobile phone. So my next question is, how is the digitalized health first approach helping to make a case for, health first organization?
Yeah, I can give a little bit of, I can give some thoughts around it. I think the biggest case for, AI and machine learning is in terms of learning from the interactions that some of these programs can have with employees. So interestingly, there are players in the market today which can guide your preferences. Let's say if you want to run a health challenge and you enroll with a provider, you have AI and ML algorithms running at the background, which will actually uh, coach you and teach you in a way that you can actually form habits. See, in well-being strategy, habit formation is very important. A lot of people cannot break their habit. That's why either they are already suffering from an ailment, or at high risk of suffering an ailment, right? I think that's where I see a lot of these new age providers, startups, ecosystem in India really coming up with great ideas where you can engage with the employee and customize and personalize the plan in such a way that you can change habits. The second big use case that I see is that how can you offer affordable insurance by use of machine learning or big data that is available to all these underwriters, whether you talk about ACO or some of the others. Because right now, there is no real, I would say, um, incentive from the insurance companies to live a healthy life. So, there is no centralized repository. The insurance companies don't really understand, some of the companies have done a couple of things, and, some of the private players have done that. But it will be interesting to note that now you have claims data, you have so much of data about demography. What are you doing with that data to really incentivize and lower the premiums so that there is a real incentive for the employee to stay healthy, a financial incentive as well? Because, as you know, medical insurance costs a bomb today in India, right? So that's another area that I think is quite an active play for AI.
Yes. And some organizations are tapping into that data, and it's also helping them, predict attrition and, those kind of things also. Biresh, I would like to ask you, how are you enabling, your clients to leverage technology to personalize organizational health?
Right. So we are actually moving towards all that Tushar talked about, right? Offering all these services as part of the app that we have. So as I was saying that many companies are still working with, many employers are working with companies who are still running insurance as a very offline and very offhand kind of a service where there's no role of any technology or any of these things that we want to do in terms of offering these services cannot be done, right? The moment we start using the technology where we are trying to put some app on the employees' smartphones where we can start offering these services right from providing a doctor on a call or starting tracking their habits and then using those to see how we can lower the I would not really say that it should be very cost focused, but lower the incidences of hospitalization, right? I mean, that should be the focus, which will really benefit the employees, that if out of 100 people, if 6 people are going to hospital, how can we lower that 6 to 5 or 4? Okay, or in the people who are more prone to such kind of conditions, right? And move people more towards healthy behavior, healthy lifestyle, and hence better health conditions over a long term. Okay, which on one side provides better health conditions and outcomes for the employees, and also creates a very different kind of a culture and a mindset, and different level of productivity for the employers as well. So we have started coming up with this app, which I believe we were the first insurer to come up with this, which helped a lot for the employees in terms of, for example, the flexi benefit that I was talking about, or having everything with them on their phone, which was not really available earlier. And over time, we will come up with all of these solutions where we will move towards incentivization of healthy behavior, on creating healthy habits through gamifications, by organizing some challenges and stuff like that. And all of this is something I believe goes a long way. Right now, we see this, the overall healthcare ecosystem has a lot of technology players which have started emerging. And if we integrate all of that and integrate all of that with insurance also, which is part of the overall employee benefit, this is something that can help both the employees and employers in a big way.
Shirupa, I would like to, yes.
Sorry, I just wanted to add a point here. I think when it comes to AI and ML, one of the major challenge that organizations today face is the unpredictability of medical costs, because, at least on the health and insurance side, that is the most significant percentage of cost that we contribute towards benefits, and it is pretty unpredictable every year. Until it's about a quarter to renewal, we don't know which direction things will go in. So I think that's a space where AI and ML can step in, and to make more predictable and more reliable models around how these costs will pan out, not just for a year, but over a few years, given the amount of historic data that we have available. I think that's one space where these models have a lot of play to bring in.
Interesting thought, Swati. Shirupa, I'd like to ask you, how does cultivating a health-first environment help to overhaul trends like the Great Resignation and improve employee retention?
Great question. So, the Great Resignation, I think, is more true for healthcare industry and the IT industry, to which I belong. This is, of course, fueled by extreme demand, leading to increased workloads and burnout. People in this industries, like all other industries, had changing priorities, but they had more options available, and the burnout rate was much higher. So when we go through some, research data, we see that the HBR analysis, where they have, analyzed the data of 9 million employees records of 4,000 global companies, we see that the job switch or the resignation is happening highest for the mid-career employees, and it actually decreased at the entry level. And they are also saying that 42% of the employees, and this is US data, are considering quitting in the next 6 months. And this is, gender agnostic. So, it's pretty standard to see that workers quitting their jobs for greener pastures when the job market is strong and when there are lots of opportunities available. When the stars align, like they're aligning now, workers gun for the better pay, parks, flexibility, and treatment. So that is happening. Now, when there is a job switch and it's basically a talent churn which is happening. So what is becoming increasingly important is the parks and the flexibility and the way they are treated. So, when the data is analyzed, it is seen that this is the area, this is the reason. It's not for compensation that people are leaving. It is around these 3 areas that people are leaving. And the 6 pillars of employee well-being being 6 or 5 pillars, maybe: job security, financial security, health, support, work-life balance. But, so job security, financial security is kind of given in when the demand for talent is more. You know that you'll find a job. But health, support, and work-life balance, they become very important. And, what are the new parks that people are talking about? I think being able to work from anywhere, not only today when there is a pandemic situation, but in future, long term. So people, when we are hiring, they're asking that question that, what are your long-term plans? And our long-term plans, we have changed. We have said that you don't have to come back. So you be in a location where we don't have an office, doesn't matter. Be there. If you're an individual contributor, more so. And even when, this is behind us, and I hope that soon, that we don't plan to go back to office every day. So I think that's something people are specifically asking for. People are asking for, are questioning, asking more questions on medical insurance. They are asking, what have you done for the employees during this period? And these are conversations, real conversations, which we actually did not see maybe 2 years back. So
very rightly said, Shirupa. We are a little pressed with time, and I want to cover the mental health aspect also in this discussion. But very, very thought-provoking points. And I agree, that the factors that are leading to great resignation should be turned around to actually sow the seed for great attraction. Otherwise, forget it. You're not going to win the talent war and attract talent. Satya, I would like to ask you, Shirupa rightly mentioned that the middle management level is the one that is really facing the burnout, and some of them are really reshuffling their priorities in life. To you, I want to ask you is that how are you creating a health infrastructure in your organization to incorporate mental health also? And there is also an audience question in this regard. Somebody wants to ask about mental health.
Sure, Pooja. I think maybe I should first answer with a piece of statistics that I have. We were half our size 3 years ago, and we have doubled to reach 11,000 and beyond. And interestingly, this is the time when most of us had shut ourselves in our home. In the last 2 years, nobody has seen anybody. That means a big amount of workforce, like Swati was mentioning about, most of their workforce have not come to the office. So we have doubled ourselves. We have got people across the globe. There are geographies where we have grown in scale exponentially. And yet, today, when I look at my December employee engagement index, which is an annual one, we have a huge response on the high 70s. The engagement score is on the high 80s. And that is a kind of a referendum from the employees that whatever we have been doing for them has been working well. The most important factor we should not forget is the psychological factor. Whenever we meet people eye to eye, that reassurance flows faster. When we are remote, how do we do that? So whatever we have been doing in terms of building our health first infrastructure, placing a higher priority on the mental or the psychological well-being of the employees have really turned out to be well. These are our daily Zoom connects where our HR executives sit and wait for a call. They have serviced more than 1,000 calls in the last few months or so. That gives a different kind of an impact rather than a chat bot or a portal query or whatever. One important thing that I would like to emphasize here is we have to have a multi-channel, multi-touch kind of an approach. You never know in which shape and form an employee would reach you. It might be a mobile app, it could be a portal, it could be a Zoom call, it could be a direct distress call or whatever. And this is backed up. I mean, we have scaled up our employee assistance portal with our partner globally. All our employees are covered by that. There are situations with me or my HR team deal with people. It is always possible. But then we have to draw a line. We are not counselors all the time. There are certain things which a professional needs to touch in, and we rope in those professional counselors, be it in the case of a bereavement or various other forms of agony that the employees face. We need to connect them fast and quick with an agile approach to the right kind of people who can give them the mental solace. Keep a track on them, keep an eye on what is going on without being intrusive. We need to be careful and sensitive about that. So in a nutshell, I would say that the basic infrastructure that we had 2-3 years ago, augmented by the agile expansion that we did in terms of whatever we did, has been, our stance has been vindicated with a thumbs up by our own employees.
Interesting, Satya. Brish, I would like to ask you the same question. How are you supporting your clients to cater to mental health issues in their organizations?
So mental health related hospitalizations are part of the coverage anyways. And just because of the importance of this topic, in fact, there was a regulatory guideline that all of this should also be mandatorily part of the coverage that any insurer is providing. As part of our end-to-end coverage, we are actually going one level beyond that and offering any mental health related solutions in terms of a chat with a doctor as part of the teleconsultation that we are offering. We also organize sessions related to these, which talk about how do you manage stress or any such situations in the workplace. So this is, of course, part of the insurance solution overall that we are providing towards the mental health part.
Swati, any point from you on this?
Yes, sure. So I think we run a lot of mental wellness programs in PepsiCo. But what I've realized is creating that spirit of, being okay about asking a question that is troubling you to someone. That spirit is extremely important. So while we do so many programs, I think one of the things that have stood out for us is the webinars or, an expert talk kind of a session that we conduct. And when we conduct these, we pick up very pertinent topics to do it. Maybe something to do with, particular employee group, like somebody was asking on the audience, what can we do if, we have single mothers in the workforce? So those are good groups to address through these sessions. So when you pick up a topic which is specific to them and you get a counselor, so what happens is, one, of course, you get the group of people together and they're comfortable interacting over a webinar, and two, they also get to know each other. So in that way, I think you create a small support group or a network of such people within the organization, and then it grows from there. So they exchange notes, and then they slowly spin off to creating an ERG or an employee resource group within the organization. They themselves want to conduct a few sessions for others. They could be awareness sessions. So in that way, they're not just addressing their own problems, but they're also finding that that safety net within the organization where they can be their authentic selves. If they have a distress, they don't really need to go to the EAP service, but they can even just talk amongst each other and solve the issues. So I think that network, the webinars have worked extremely well for us, but I think what is important is to establish those small networks within the organization wherein people feel safe, feel empowered, and can share and identify with what it is that they are going through.
One closing point from Shrirupa and Tushar. Tushar, you'll go first.
No, I think a lot of it is already covered, Pooja, but I think as an organization, we have to keep on reiterating that it's okay to not be okay, right? And put on your oxygen mask first before you help others for the people leaders. I think these are my two parting thoughts. But I think it's very important topic which will impact business strategy as well. So I think that's where I think it is becoming a really big focus area for all organizations.
Shrirupa, 1 point from you.
I think, it's a very important topic which was shoved under the carpet for a long time, for whatever reason. But I think this 2 years, I have seen it coming out in the open much more quickly than it had ever before. And that, I think, is a very positive, thing which has happened out of the entire thing. And there are many instances where people have reached out asking for help, actively asking for help. I think that is somewhere tells me that we must have done something right, where people feel safe to come back and ask for that help, or say that I'm not okay. I think that's what my closing comments would be.
Yeah. Satya, we started with you, and I'd like to end the session with your closing remark.
Okay, I think let me close with this remark. We need to cheer ourselves up. When my firm philosophy in life is, when somebody walks into my cabin, they need to go out much more positively with the few minutes of interaction that we have. So every transaction that I have with any individual from the office, I just want to imbue it with that kind of a positivity so that people can take it back. I am a firm believer that a sound mind defeats half the diseases. And I've been advising to my employees also, whenever I've been getting in touch with them, you stay cheerful, a lot of problems can be overcome. So you get confused in your mind whether this mask or that mask, or whether this vaccine or that vaccine. By the time you decide, Corona would have decided what to do with it. So we encourage people to stay positive all the time, and then they would be able to become a pillar of support. Those are my words, Pooja.
Very wise words. And with this, we come to an end of the session. Viewers, I hope you found this session insightful. Leaders did share some research points, statistics also with you. The bottom line is that we have to have preventive measures in place. With health, precaution is must, and insurance is a very, very sharp tool for our mental as well as physical health, as well as keep ourselves prepared for any eventuality that may come our way. With that, thank you, Shrirupa, Swati, Tushar, Satya, and Biresh for joining us today. Time to switch off. Thank you, everyone.
Thank you.
Thank you.
Thank you so much.